Gallbladder problems are very common, and people do get surgery for the gallbladder, but with any surgery there are certain complications that can happen. And this particular patient had surgery 3 weeks ago and developed from somewhere else, and developed various symptoms like vomiting. She wasn't eating, she's in a lot of pain, and she's got fever as well. So somebody mentioned to come to our London Gastro Care, and one of the most important thing is this gentleman works in one of the renowned pharmaceutical company. Due to confidentiality, I can't able to express that. So he does have some medical knowledge, and just listen from our patient what journey they have gone through, and how they felt about the outcomes from the treatment that you had. So Vipin, you have been, your wife had this gallbladder problem today.
Yes.
Yeah, what was the problem that you went through, and how the services you received?
So actually, sir, last month, 26 September, she had a gallbladder surgery, and we were waiting. She was having some discomfortness, everyday nausea, vomiting, and weaknesses. So we are speculating that within 1 week, 2 weeks, it will be better. But day by day, it was getting reducing the weight, and she was getting discomfort continuously. So one of our doctor recommended better you go to the London Gastro Care.
So it's interesting that I'm very glad that was I felt like I received an award, because I don't actually meet any other consultant colleagues in this area, because I'm very new to this country, and somebody came to know our services and recommended that, which is which I feel like unprovoked recommendation is like me receiving an award actually. Yeah, and in fact that she was very unwell that day when she came.
Yeah. When she came here, sir, we remember that day, sir, last week only, and she was not able to sit for 10-15 minutes. We have requested at reception ki please request doctor to attend us as soon as possible. And when she entered, sir, you told ki immediately you told there is some septic problem after the gallbladder surgery, and don't worry, I will send you with a smiley face at your home.
Is it?
Yeah.
Was it a confidence for you?
That's true. It's working that day.
Yeah. Mm-hmm.
So after half an hour, when you investigated and primary investigation done and some your procedure done, and she was feeling happy, she went with me evening at home there. Yeah. And she had juice and all. She was feeling so comfortable.
First time you ate something after a few days.
After 4 or 5 days.
After 4 or 5 days. Yeah, and I mean, I should say that she's very unwell with septic. Yes. What we call is cholangitis. Yes. It does happen because the stones from the gallbladder, they drop into the bile duct, which is what caused the symptom. And I don't know why things hasn't been picked up a bit early. You left it for 4 days before you came to us. But anyhow, the outcome was, and then we suggested that we should unblock this tube immediately by ERCP. And I know you had hiccups with your insurance, saying that they denied the process for you.
Yeah, we have a speculation because the hospitalization, many clause and pros and cons of
so the important thing is that you have taken that. You thought your wife's health is important.
Yes.
And that's a very good husband. I think you're very lucky.
Yes.
He said, whether whoever pays, I don't care. I want her to get better.
Yes.
That's what he said.
And not only that, sir, and the way you are helping to get that also reimbursed, sir, by your recommendation and a strong recommendation of buying in the form of letter, sir.
No, that's the humanity. Basically, yours is a genuine problem. You're going through is part and parcel of the same disease. It's not that I'm doing something different. I would have done to any human being. It's not that you've been different. I would say this is post gallbladder. There is stones that can migrate to bile duct and then things like that. So you had this surgery ERCP which went very well. We unblocked this one. Your liver test has completely come back to normal. So if you have to say 2 words about London Gastro Care, what would you say? And how do you feel different to any other places?
See, sir, I have been working in pharma industry since last 12 years. Okay, so I've been visiting so many corporate hospitals, so many clinics, so many polyclinics, so many individual hospitals. The kind of the setups you have built, sir, the complete cure of gastro problems. You enter in throughout the reception, starting from
we
one.
went ultrasound so many places. They didn't find
What is
there
the problem?
Stone. What is the problem? But
Yeah.
you saw me that day and say stone is there, I think, and that's true.
So, if anybody want a complete care for Gastro Care,
Yes.
undoubtedly close your eyes and come to the London Gastro Care, and I can experience.
And one more thing that you did say that you are in conference with London.
Yes.
When you dropped your wife, and I felt very much appreciated because there are two important things for you. One, your wife, and the other one is job on the
Yes.
same day. And
Yes.
you went for the cross conference for UK, and the person from UK told something about us. What is that?
Yes. I was attending one conference and I said why I got late by 15-20 minutes. I left my wife there, London Gastro Care. Dr. Puli is there. So one of my colleague told, Dr. Puli, so he was working for another pharmaceutical company. I can't took the name of that company. And
that's a big one as well.
Yeah, his MD was talking about, Dr. Puli is here in Hyderabad. I said yes. After 20 years in UK, he is in Hyderabad and in KPHB. So I encountered because of my wife health. And so the kind of, sir, I don't know why you are, sir, serving so much people. And let me tell you one thing again, because we don't know it is going to be reimbursed or not, but sir has helped reduce whatever the lower costs are you've given the treatment for my wife, sir.
No,
This is
saving lives is more important.
Yes.
Yeah, and the most importantly, the company you're talking about is the world-renowned company, and
Yes.
they made the vaccines for COVID.
Yes.
And that MD was talking about us on video conference.
Yes.
And obviously, you told me that they were actually googling my profile and said this is the same Dr.
Yes.
Puli.
Yes.
Yeah?
They wanted to double cross. This is Dr. Puli only. Yes, Dr. Puli only. Yeah, I have been meeting since last 2 days because of my wife health. Is it? He is here. Yes, he's in here. So, sir, we are very grateful to come here.
We are blessed, sir.
We are blessed to come here, and it was fantastic experience while coming last 4-5 days, sir. The way you have handled her symptoms and the cause both, it was phenomenal.
Thank you.
Thank you so much.
Thank you very
Thank
much.
you.
Yeah, I'm very blessed to have patients like this, where he gave me lots of happiness in me because an unprovoked referral from somebody just knowing our services. Number two is that because he's knowledgeable and then acceptable to what we explain, and he's gone through, despite there are hardships for him for the various process because he got the insurance, they were like difficult for him and whatever it is, but he put the health of his wife, and that's the fantastic partner you ever received. And then overall she's better now. Thank you very much.